you. Glad to be here, though. It's a great experience for me. So,
Good day, everyone, and thank you so much once again for joining in the Charms MEDI-HELPZ and Mother is Supreme 2025 Black History Month, where the theme is Blacks and Labor. What us being a health research and a health resource nonprofit, what we decided to do was we decided to take a spin on the official theme and name it Health Through Our History, Healing Through Our History. And that's because the medical and the healthcare fields, while many think they are one and the same, there are a lot of differences, but there are a lot of similarities and there's differences in both. And excuse my tied tongue for the day. But we are, that's where we are with this. And what we need to do, especially in a political climate that we're in right now, we need to keep our eyes on what's going on in the healthcare field, what's going on in the medical field. Not only just keeping an eye on the history in the health system, but also introducing to our high school students, heck, even junior high school students, college students, all of the fields that are available for them to work in the labor sector in healthcare. One such field is nursing. Many say, I want to be a nurse. Well, what kind of nurse do you want to be? A lot of times they don't know what kind of nurse that they want to be because there's so many different sections of nursing that you can go into. But one thing we wanted to highlight this year during Black History Month is if you go into the field of nursing as a Black or brown man or woman, what are the benefits and what are the risks? So that okay, you have an idea, okay, there's some there's some things that I might face, and here's some challenges that I'll go through, but here's how I overcome those challenges. We appreciate all our nurses, we really do, but we know that there is a distinct difference between an African American / Black nurse and any other nurse. We know that there's a difference. And I'm not gonna, go into that any further. We know there's a difference, and we want to address that difference so that as far as the labor sector goes, we don't have people entering into the field and just giving up because they feel like this is way too much without having any idea or any tips on this is some stuff that you might face. So I am going to stop talking and I'm going to turn this over to our illustrious senior subject matter expert, Tracy Thornton Wesley, and she's gonna be our interviewee for the night as we go through some questions. So Tracy, please introduce yourself.
hello, everyone. I am Tracy Thornton Wesley. I'm a registered nurse with a double master's degree. I've been a registered nurse for over 30 years. I currently work in corporate America, but I started my nursing career as a med-surg nurse working on a floor in a community hospital. And I have experience in PACU, telemetry, ICU, um, cardiac, respiratory. So I am very familiar with working on the floor as well as working in corporate America. And there are some differences, and I am here to discuss them with you.
Thank you so much, Tracy. On behalf of myself, as well as Charms MEDI-HELPZ Foundation, as well as Mother Supreme, we say thank you so much for coming together with us and actually speaking on these very questions that we will be asking. The first question is this: can you share your experience as an African American nurse in the healthcare system?
I sure
And you did
can.
a little bit of that just then, but give us some more on what you actually did. What is PQ? What is telemetry? Break that down for us for health literacy purposes and tell us what PQ is and what telemetry is.
Well, telemetry is when, working on it has something to do with your heart. It has everything to do with your heart. So it's just monitoring your heart. Um, A lot of patients may come in with what you call congestive heart failure. They may have other cardiac issues. And so on the telemetry floor, we monitor those patients and we also specialize in the cardiac medications. And we also have units where patients are waiting on a heart transplant. So that was a very interesting unit for me, and I've also worked on a unit as such where they were actually on a drip waiting to get that heart transplant. And whenever they would get that heart transplant, we would celebrate. We would celebrate. We got a heart. We got a heart. It's time to go. It's time to go. So yeah, that's telemetry. But PACU, PACU is um, post anesthesia recovery unit. And that's when you go into surgery, you come out of surgery, and you go into the PACU area where we would monitor you. You would be placed on, some patients come out on the ventilator, they come out connected to all types of tubings and we monitor them so that they would be stable enough to go onto the unit or to the floor. It's not a unit where patients would just stay overnight. We just make sure that when they come out of surgery, that they are pain-free, they're comfortable, they're breathing properly, they get the right amount of fluids. So we just stabilize them even more. So that's what PACU is.
Thank you. Now, have you, and I know you said you worked in ICU before as well, correct?
I've
Have
worked in
you worked in
ICU,
adult ICU and the pediatric ICU or just the adult?
adult
Okay.
ICU.
Is there a reason why you decided not to do the pediatric ICU unit?
It was very hard for me to watch the little ones become so sick. And when I was in nursing school, that was something that I knew I could not handle. It was too emotional for me. So that's the reason why I preferred the adults.
Now, I do know of another family member of yours because she's actually on our board at Chums, and I want to ask you a question. Was there someone in your family or people in your family that had said to you or that you watched as a little girl growing up and you was like, I like what they're doing. I want to be a nurse. Or is that just something that you just picked out of the blue and said, this is what I want to do?
Actually, my mom worked in a hospital and she worked in radiology. And during the summer, she would sometimes bring me with her to work. And I liked the environment and I saw how caring the people were inside of the hospitals and how they were taking care of people. So I've always wanted to work in that environment because I always felt like it was clean, you know, it was cool, it was nice, and I just liked the feeling of it. But that's what got me started. And so then my mom um got me into this nursing assistant program that they offered at the hospital in which she worked. And I took that up and I became a nurse's aide, worked with the elderly. And I mean, the rest is history.
Right. You were sold after that, right? You're like, I'm this
Hmm.
is this is where I am. This is my career right
I
here.
loved it. I loved it because I always knew, you know, I now I realize that I did not choose nursing by accident. I felt like I was called to nursing. And I've always had the personality of wanting to help out, wanting to help people and wanting to make a difference. So I just felt so comfortable um, in this field. And I still feel comfortable, even though I'm not hands on with patients. Um, I work remotely in the corporate world. I still do learn so much more reading clinical every day and just learning about the different medications, the different treatments. And so now I'm at the stage in my life, in my career, where I just want to make a difference. I want to make a difference um, with the younger nurses. I just want to be a mentor. I want to encourage them because truly, Sandra, there's a nursing shortage. I mean, there's a nursing shortage, and there's definitely a shortage of Black nurses. Where are they? And I want to encourage them to come on board. I'm not saying that it's going to be easy, but you can do it. And if it's something that you're passionate about, you can do it. And so I want to be a mentor. I want to be a coach. I want to encourage, and we can talk about the challenges and the growths, that you would encounter in this field.
And I thank you so much for that. And you're right. When we look at the overall numbers for medical, the medical field, period, the numbers are increasingly low.
Hmm.
As far as our Black doctors, we have 8%. Out of that 8%, is maybe 2 or 3% that are African American specialists that are specializing in medicine, in this particular field. We have that issue going on. And I'm quite sure that the nurses aren't going through the same exact thing where they're leaving the field because they feel like, I'm fed up, I'm never going to make a difference. Their hands are tied because the things that they once could do, they can no longer do. They say that's not your job description, since medicine has become a business versus a true empathy, and an empathetic career.
Hmm.
It's become all about business. Why was you in that room with that patient for 20 extra minutes when you shouldn't have been? You got to answer stuff. And then you like you said, you look at the fact that you're an African American slash Black nurse, and you feel even less competent at times just because you don't have those resources that you need to have. And we have to up those numbers, and with the exclusion of D&I efforts and an exclusion of, okay, well, we not paying for this any longer, you have even less going into the field. So what happens to our community when we're down to 2% across the board for medical and health? What happens at that point in time?
Right.
So we
Right.
have to talk to our young people, and we have to say, hey, here's a field you can get into, and you can go into so many fields. You're a nurse, you don't work in the hospital or with the doctor's office, but you work in corporate America. So
Hmm.
you could be a nurse and go into any number of fields.
Yes.
Um, you're a nurse, and as we was talking earlier, you actually get ready to open up an assisted living facility. It's
Yes.
something else that you could do. You can
Yes.
open up your own business. You could be an entrepreneur as a nurse. You got nurse legal and then nurse legal advocates. You got nurse advocates. You got, so many nurses, physician assistants. You got a whole
A
spectrum of things
plethora.
that you want to, right? A plethora of different topics that you can get into if you just come on board, and you'll never be bored. I promise you that. I've said that from day one. You will never ever be bored in of healthcare or medical field. It's just not going to happen. So if you
Mhm.
like to get your hands dirty, or not even so much dirty, but you like to keep them filled, it's definitely
Yes,
a field that you want to be in. So
that's
thank
right.
you for that. And I do want to now ask you about your cultural upbringing. And can you give us a little bit about your cultural approach to nursing?
Um, I must say, Sandra, that in this field, as a Black woman and as a nurse, it meant more than just, and I think this is why we have a lot of nurses that are, I might say, intimidated or feel less than. I mean, it's because you're not only judged by your clinical skills, you know, you're judged, you should be judged solely on your clinical skills, but you're not. You're judged by the color of your skin, and it's just not fair. And I think that it just run a lot of the nurses away. And so I had to learn how to navigate in spaces where I was often, whew, the only person who looked like me. And it meant that I had to prove myself. I had to work 10 times as hard. I had to dot all my I's and cross all of my T's. But I want to tell the nurses out there that that only built me up. Um, it made me a better person. It taught me how to advocate for myself because in this field, there's a lot of competition. And there's a lot of nurses that just feel as though their work and their abilities have been watered down, overlooked. And but it's hopeful. I mean, that's why I myself want to step up to be a mentor, to encourage these nurses, to let them know that you can do it and you belong as well. You belong. You're intelligent, you're resilient, and you can do all things through Christ who strengthens you. I've seen firsthand how when you comfort patients or encourage them, the patients that look like you, or they feel more comfortable, they feel more confident. And the same goes for the nurses. When they see you, they can see themselves being here. I just want them to know that they can make a difference and they can navigate in these spaces as well and be exceptional as a registered nurse. I didn't start off, as a registered nurse. Of course, I spoke earlier on that I was a nurse's aide. I worked and I worked. I worked as a nurse's tech, and I did have some nurses within my community to encourage me. They encouraged me to go further. You can do it, Tracy. Go further. Go get your RN degree. You can do it. I was intimidated initially. Yes, I was. I'm not gonna sit here and pretend as though I wasn't. I was unsure myself. I felt as though, you know, I uh, I couldn't do it. Would I make it? Would I be accepted? I didn't know, but I pushed forward, and that's what I want to I want to encourage the younger nurses to do the same. You can do it because we need more of us to show up because like you stated, I mean, the percentage of the Black doctors, where are they? Um, I don't know. I don't know what's going on. Where are we?
Thank you so much for that. And I want to ask you, when you think of that, and you're right, what when you're put in a difficult situation, one in which, you like, my back is up against the wall. I'm doing all that I can because I've been in situations like that where I'm like, I've done all I can. I crossed all my T's, I dotted all my I's, went to school, got educated, have this, that, and the other going on for me, and I'm dedicated to what I do, but yet here I am going up against someone else who's given, okay, well, we're going to give you this because you're a man or because of the color of your skin, while I'm the one that's doing all the work without any recognition coming my way. I'm the
Mhm.
one doing the work, but you're the one that's getting the credit for it. And it built up a sense of resilience in me.
That's
I'm
right.
like, I'll be darned if I quit. I'm not gonna quit. I'm gonna take what you give me and I'm gonna put it in boxes and I'm gonna surround myself with those boxes and I'm gonna learn all I can to do all I can to be a resource because our community needs it.
Mhm.
I say all the time, give the theory about, not so much a theory, but I give the analogy about the yellow school bus. The little yellow school bus coming down our street is not going to stop at our houses and give us a kind of information or treat us in such a manner where we know that we're getting the best of the best.
That's right.
And I talk to patients all the time, and they tell me, and I cringe when they tell me this. Well, I need to find me a black doctor. Until I find me a black doctor, I'm just not going to take my medicine. I'm just going to self-medicate. I'm like, what are you talking
Mm,
about? You're not hurting the doctor. You hurting
mhm.
yourself.
Exactly.
And at the
And
same time, you're saying, "Well, I'm a Christian or I'm a believer of this faith. I love my family, love my community." But how can you seriously, if you're not doing what you're supposed to be doing to take care of yourself?
right.
How can you seriously say, "I'm not going to do this unless I get a black doctor"? I get it. I mean, I'm one of the fortunate ones that has a beautiful black doctor. Um, and I look forward to speaking with her because she understands where I'm coming from. And so we need black doctors and we need black nurses and we need the whole plethora of allied health and medical professionals. We need you. We definitely,
We do.
definitely do need you.
We
I
do.
want to ask you about the barriers, the challenges, and the benefits of being a nurse.
Mhm. Mhm. Um, I'll tell you, throughout my career, I've encountered a lot of challenges that went beyond patient care. I mean, it's I work as a denials coordinator, and there were times when I felt like my voice wasn't heard or I was overlooked. My work was diminished, um, watered down, or my expertise was questioned, and not because that I didn't have the ability, but it was due to the biases that still lingers on today. I've had to work twice as hard to be seen and to be heard. But those experiences, like I said, it did not break me, but it built me. And so that's where that growth factor came in. It built me, it taught me that I was resilient. I could do it. It gave me a voice. I became an advocate for others and myself. I used to be an introvert, very shy and, quiet, timid, sort of. But nursing helped me to grow. I grew into a woman. I was a young adult, pretty much a child going into nursing. But as I matured into the field, going through all of those challenges, and I think I used those challenges and it just helped me to build muscle, gave me the strength that I needed and the courage that I needed to make it. Not only make it in nursing, but in life itself. So I took my experiences and now I'm able to even navigate this thing called life and not only encourage others, I still continue to encourage myself. Even working now today as a denounce coordinator, I go through challenges. It has taught me how to conduct myself as a professional, how to handle conflict. You learn so much. You learn so much about yourself, Sandra. You learn what you are made of. And that's the growth. That's the growth part. And that's the best part for me. And I love it. I love who I have become. I love the fact that I not only embrace the Black nurses, but I also embrace my Caucasian nurses, show them that I love them, that we can work together. We can do this thing called nursing together. And it's a blessing for me. It truly is. And when I come across challenges and I notice things or statements that are unprofessional, I understand how to be professional. And let's have a meeting. Let's have a talk. We need to talk about it. We can sit down and have a talk, a professional talk, and resolve these issues. Let's resolve this right now. So I've grown up a lot over the 30 years of being a nurse.
And that in itself, that growth period in itself is a great benefit to have.
Yes.
When
Mm-hmm.
you take the time and you come to the end of your career or you're in the middle part of your career, take that time and reflect and say, you know what did I benefit by being in this field? How
Mm-hmm.
much have I learned? What can I give back? What can I do differently to help someone else? I'm often told by nurses, once a nurse, always a nurse. I don't care where I go, I'm always a nurse.
Yeah.
The same
Always
thing to
wanted to
teach.
help.
Right. The same thing the teachers say. Once a teacher, I'm always a teacher.
Always
So,
want to
you
teach.
know, right. So I get it. And you're like, you should come into this field. And I truly do get it and understand it. I look at it now. I remember my grandmother was a CN, one of my grandmothers was a CNA and one was a nurse's assistant. And I look back on it now and I look at their lives and what they did and how they would always often talk about the work that they did.
Hmm.
And I see, the nursing now, it looks like it's actually changed a little bit as far as the seriousness of the career path that they've taken. Is that true, or is that just no, Sandra? It's still there. We still got that same ethical mannerism about us. It's just that because of the times, it just looks different.
Well, I can say this. I am an advocate for my family because I have to be. I listen to their stories when they go into doctor's appointments or into the ER, and it has changed. It's different. Um, the education is not there. Patients walk out of their doctor's offices and they don't even understand
Hmm.
what it is that they need to do in order to care for different diseases. They just don't know. They don't have a clue. And I just don't understand that. It's almost as if they have become robotic, that the patients are, I don't, it's sad, but I think they feel as though they are just numbers. They're not being taught. They come out confused. They don't know what to eat. They don't know anything about their disease. And I just, I'm floored when I hear that. I
Hmm.
spent 30 minutes on the phone helping my aunt who needed a port placed just to get the time for her surgery, for her procedure.
Hmm.
And you spend all day being transferred and there's no communication. I've myself have gone into the ER and noticed that the one on the I mean, the basic nursing practices, it's not there anymore. It's not there. And and it's kind of disheartening. It's disheartening. So we need nurses to come on board who has a heart to do this work, who want to help, who wants to educate. We need you. We need you because yeah, you can make a decent living, a nice living, but it's not all about the money.
Hmm.
If you can just put that aside, because when I first started nursing, I I don't remember thinking about the money. I was just proud to be a nurse, to be in the
Mhm.
profession, to help. And then later it hit me. Oh, okay, this is what I'm making. But now I'm not sure. Are you here to help or are you just here for a check?
Mhm. And it's sad because the patients pick up on it.
They do.
They pick up on it, and so, and we've had this conversation throughout this month, and I've repeatedly said, we have to do what we're doing from the empathetic side. We cannot continue to do it from, okay, well, I'm getting paid this much money because money is important. Don't get
It
me
is.
wrong, money is very, very important. But when you're in a healthcare field, in a medical field where you're impacting people's lives, you have to have a heart for the patient. If you don't, it doesn't work. The whole system falls down because they're not going to trust you. So what makes you think they're going to trust the doctor that you are working for or the hospital that you're working at if they can't even trust, the nurse who
That's
they're
right.
supposed to be able to trust?
That's
Yeah,
right.
we've had that conversation, and actually, one of our presenters brought it up and said, "Sandra, she said, I don't know what happened. What's happened?" She said, and she was a young, she's a in the maternal space, but
Mhm.
she's young. But she's like, I don't know what happened. Like it's like nobody's doing the job anymore because they care. Everybody is like on their own thing,
Yeah,
and that's unfortunate for
it
all of
is.
us. It's unfortunate.
It is.
So I have another question for you, which is centered around your support system. So who's been your biggest support system and who's been your problem child and trying to get you? Let's start with your support system who's been that positive support model, other than your husband.
Um, I have colleagues and friends
Hmm.
who are my support system, and I have people that look like me. We have to support each other. And a lot of times we hold things in and we suffer in silence. And we later would find out that, you would think, oh, is there something wrong with me? Am I doing something wrong? Am I not capable? But then you find out that your colleague is going through the same thing. So we support each other and
Hmm.
we become our own support systems and we navigate, we encourage each other, we help educate each other. I also have doctors I've worked with who was my support system, who would tell me, you could do it.
Hmm.
You could do it. You are a good nurse. I've had a director who's retired now. She didn't look like me. She was my support system. She pushed me
Hmm.
to be a leader. So different people. Some look like me, some did not.
Hmm.
Yep. And of course,
And
my
that's what you
husband.
have to do. You have to surround yourself with like-minded people,
Yes.
positive people.
Yes.
That negative person that's around you, that Debbie Downer, that's around you, is not going to help you to be successful in whatever career you're in.
Mm-hmm.
And being a nurse is a very honorable job to have. It's one that's looked up, it's one that's revered to actually do and have. And so it's important for you to keep yourself surrounded by those important not those important people in your life, whether
Yes.
it's your husband, your children, your
Mm-hmm.
colleagues, your pastor, whoever it is around you, your mom and dad, your sisters and brothers,
That's
whoever's
right.
around you. When it gets to be a negative situation, you're going through a tough field, it makes it hard for you to stay focused on a job that you have.
That's
So
right.
make sure that your support system is as strong as Tracy's is, has some of those very people in it that she's named, not named name, but that she's put out the positions they've held. as a nurse, but I do encourage you and empower you. And you might be saying, Sid, well, are you a nurse? And I so you know, I am not a nurse, but I've worked very, very closely over the 30 plus years that I've been in healthcare. I've worked very, very closely with nurses on a daily basis to know that, you know, they need support. They need people to say, hey, you're doing a good job, or, you know, not coming down on them so negatively all the time. It helps. And you know,
Yeah.
because of those conversations that I've had with nurses, I know that their job is hard. Their job is difficult. Sometimes you might, you know, as a patient, you might be like, well, that nurse didn't do this or didn't do that, but we got to look at it. What was their job role?
Mm-hmm.
Did they cross the line? Remember, nursing with all healthcare and medical professions is now a business. It's now not done out of empathy. It's done out of, it's a business. Do your business, get your check, and go home. And sometimes you have to be willing to stay just a little bit longer and push a little bit harder. And then my next question for you, Tracy, is this: what, as far as experience wise,
Mm-hmm.
when you were a CNA, were you into a 2-year school program, a community college? Where did your education start at?
Within a hospital who
Okay, so you
offered
were,
the C who offered a CNA course, and
okay,
then I received a certificate at another school, a
okay,
community. Mhm.
okay. And then was that a 2-year or a 4-year
No,
community?
for CNA, it was about maybe a 12-week program.
Hmm.
And from that 12-week program, then you can start. I did start taking up courses towards my RN degree
Mm,
at a community college.
mm-hmm.
Then I went on um, to receive my bachelor's at a university, and then my master's. So I kind of like climbed,
The
I,
latter. But
yeah.
the important part is that you learned. We had another presenter on last week, I believe it was, that also spoke about how she started in a retail store. And she took what she learned from that retail store, pretty much like what you did. You started at the hospital, you took what you learned at the hospital, you built into what you learned at the hospital, you went to the community college, you got your certificate from that community college. You was like, no, I'm going to get my BSN now. You
Hmm.
moved up, and now I want to get my master's. And then after that master's, I want another master. But you kept it going. And I'm bringing that point up because there are students that are in junior high school or high school, and they're like, when I get out of school, I don't want to go to a 2-year college. I don't want to go to a 4-year college. Well, there are jobs in the healthcare sector, in the medical field, where you really don't have to have a 2-year or a 4-year degree. You could start off at an entry level. Start off at
Hmm.
that entry level, see if you like it, see what you really want to do. Most jobs nowadays, they offer tuition reimbursement.
Hmm.
Take advantage of that tuition reimbursement to
Yes.
push yourself higher if you want to go higher, to continue to push yourself until you like, you know what, I don't want to push anymore. I'm happy with what I am and what I'm doing, but we have to start somewhere. So I don't want those high school students who are like, I cannot do another 4 years of school. Take a CNA course and see if you like the CNA work. And if you like it, you're going to look for opportunities in which you can continue to grow.
Hmm.
Whether it's a 2-year school or 4-year school, you're going to want to continue to grow. If you're already in a field and say you've been working in that field for a very long time and you're like, I don't want to do this any longer. This is boring to me. I want to learn something new. Um, Look into, what skills do you have that can transfer into a 4-year program, into
Right.
your 2-year program, and take those skills and let it transfer you so that you can become a nurse if that's what you want to do, become a clinician, an allied health professional if that's what you want to do. But do
Hmm.
something, and please, when you're doing something, think about doing it in health or medical because we need you.
We do.
We need you. We need you. We need you. We need you. And we don't just need anybody because that totally goes against we need to have everyone needs to have access to optimal health care.
Yes.
We do need you. But if you're going to enter into it because you want a paycheck and that's all that's there at the end of the day is that paycheck, and not the fact that someone's coming sick and you seeing them walk out healthy. If that's not what you're doing it for, please don't do it, because you're hurting more than you're hurting more than that patient. You're hurting the
Mhm.
families, the community of that patient. So we
That's
need
right.
you. We want you here. We really do want you here. But we don't want you in this field if it's something that you're not going to take seriously. If you're not going to live up to the position, what the position calls for you to
Mhm.
do, please don't do it. So I have another question, and that's
Mhm.
this: as far as the educational level, are there classes that you would say, like for a junior high or high school student that's looking to get into nursing? Are there like certain classes that you would say, well, yeah, I would really think about doing it, or organizations that may be able to lead them into a field as a nurse? Are there any organizations or educational choices that you would say would help them?
Well, when I started nursing, that was a long time ago, and we had I graduated actually from a diploma school. We don't have those schools anymore. I graduated from Jackson School of Nursing in Miami, Florida. So that was like a 3-year, 4-year, but it was a diploma school. Now I hear and understand that in high schools, they're offering classes that they could take if they are interested in nursing. So by the time they complete high school, they already have those credits. They don't have to go to um, a community school. They have credits where they could maybe start at a university. But it wasn't that way when I started out, Sandra.
Hmm.
Um, that was a long time ago. So now they're doing things differently.
Okay. And so before we close out for the day, can you give us 3 tips that you would give to not just African American nurses, well, I'm not going to say just specifically to our Black and Brown community of students, of workers that are looking to enter into the field of nursing? Are there 3 tips that you can give them that will help them along that course?
Yes, I would tell you first of all, when if you love the profession and then if you love helping, get into nursing for that. Because if you don't, you won't make it. You'll fail. You'll end up leaving. You have to have a heart for it. Um, I would say study, study hard, learn your skills, learn the disease process. Don't take shortcuts because it would only bite you, come back to bite you.
Hmm.
You it's a great future it's a very promising career, but nursing is what you make it. Don't follow anyone because don't go into nursing because someone else is doing it.
Hmm.
You go into nursing because you care and you want to make a difference. You want to help those. You want to teach. You want to see patients heal. You just want to make a difference. It's not about the paycheck. The money will come. And I will also tell you that there are so many different areas you can go into. Um, it's just a plethora of things that you could accomplish within the nursing community. And there are nurses who work from home. They want to start out working from home, but I wouldn't advise that. You need to get your skills. You need to go on a med surge floor, learn those skills, learn your organizational skills, your communication skills.
Hmm.
You won't regret it. You can't you can't skip those things. Those are practical things that you need to be a good nurse and to be, I guess, positive or to have your muscles to have the tenacity to say that I can do this. You the confidence, that's the word. You would
Mhm.
have the confidence when you know those skills, when you studied, you didn't cheat to get your nursing license. You did it the right way. Your confidence will you would have confidence and it
Hmm.
will take you a long way. Don't do any shortcuts.
You're right. Shortcuts are not going to work. They might work for a little while, but let you be called out and you got to show somebody how you did something and you took a shortcut to do it. Yeah.
It
Yeah.
comes back and it shows up.
Right.
It shows up in even the older nurses. And I wonder, where
Mhm.
did they get their
Right.
education from?
Now, how did they get that?
How did you pass the boards? I went to, like I said, a diploma school, and it was tough. Jackson School of Nursing, but it was worth it.
Hmm.
It made me the nurse that I am today.
30 years in the game is not anything to sneeze at. So when you're looking at, okay, what can I do that will give me some longevity? There you go. Get into nursing. You got the L. Now I don't know if there's another one under the LPN, but you could start off as an LPN, correct?
Yes,
And
you
move
can.
up to your RN, then your
Mhm.
BSN, then your MSN, then the field is wide open.
Even your doctorate degree.
Right.
Yeah. And you
Because
can
there are
become
doctors. Right.
a nurse practitioner.
Right.
And like you were saying earlier, you can become an entrepreneur. But you got to take those steps. Don't rush into it. Don't you can't just I find a lot of nurses they want to work from home. Well, you just got out of nursing school. I would advise you to work in a hospital to get that experience. It will benefit you and it will benefit your patients most
Yeah,
of
that
all.
you know what, Tracy, and you bring up something that's very, very real that's happening that we're looking at the possibility of happening now, and it probably is happening in certain states where they're looking at having the medical care instead of it being done in a hospital, being done in a at the patient's home. But if you're bringing in someone that's totally brand new to nursing, it's not not specifically trained for what goes on with the patient, and you bring them into a patient's home, are you really bringing them in there to help, or are you bringing them there as just a pastime?
Mhm.
The field is opening up now so widely, and you're right. If you're a nurse and you need to have that hands-on skill, at least do it for 2 or 3 years in a hospital. But you're going from nursing school into working in a patient's home as a nurse, giving them clinical care. That's disastrous.
Mhm. Mhm. It's a disservice. You're doing yourself a disservice and the patient,
Right.
and you're putting your license at risk
Right.
and your livelihood.
You are so right about that. Tracy, I thank you. I thank you so much.
You're welcome. You're welcome. We have a lot of work to do,
We do. We have a
but
whole lot of work to do,
mhm.
and people ask me all the time, Sandra, why do you do what you do? And I tell them because patients need help. And what kind of patient? They want me to numb it down to what kind of patient. And when you look at the overall picture of it, we're all patients.
Yes.
I mean, you can call it what you want to call it, but we're all patients. And we have three categories of patients. We got that proactive patient who we work with to actually get to become empowered, engaged, and
Yeah.
educated in their
Yeah.
own health field.
Yes.
Regardless of what color your skin is. Your social economic factors weigh into that, what we do and how we do it at Charms
Mhm.
MEDI-HELPZ. Then you
Mhm.
have that retroactive patient that'll say, "Oh, I'll do it whenever." Or that information you talking about, I don't need that information. I'm too young. Look at the statistics right now and notice, take a good look at the statistics of who's coming up with these diseases, these rare diseases, any type of disease. We thought we got rid of stuff, and it's back.
Mhm.
We
Mhm.
thought we got rid of mumps, measles, and rubella, but it's back
Mhm. Mhm.
because of the lifestyle we're living right now.
Right.
So all of this stuff is back, and it's not impacting the older people, it's impacting the younger people.
Mhm.
So they have to be trained, but
Mhm.
they want to sit back and wait and let something happen. It's too late then.
Yeah. I wanna say that, my mother-in-law, who since passed, years ago, she had a disease that I feel that she probably would have left us sooner had she not been a patient that was proactive. And she was one that studied and learned about her illness, her disease, and was compliant. So it's important to be proactive as a patient.
Yeah, retroactive is not going to work, especially for us African American slash Black
Mm-hmm.
patients. It's not going to work.
Mm-mm.
The gaslighting that occurs within our community, a lot of times it occurs because they think we don't know no better. And if
Yes.
we're retroactively waiting for somebody to show us up, or we ain't got time, we got time for everything else but taking care of our health.
Yes.
We're in a really bad position when we think that, someone, when we're retroactively sick and we really can't talk and we really can't move, but we haven't taken care of our health right, when we think someone's going to come along and help us. It's just not
Yeah.
going to happen.
Yeah.
Realistically, it's not going to happen, people.
It's
And
not.
then we have our active patients, and those are patients that we also work with. Those patients are patients who are currently seeing a doctor. They're going to the doctor for some active health condition they have. Only thing is they're going to the doctor and the doctor may be telling them 10 words. They have no idea what the doctor just said.
Mm,
They leave and they're, what did the doctor tell you? I don't
exactly.
know.
Exactly.
Well, hold up for a second. You just came from the doctor. The doctor didn't tell you nothing. I don't know what he was talking about. He said it so fast. We're going in there empty handed. We don't have a journal or book to write notes down with this is what they told me happened. We have nothing. We're going in there blindly and then we're leaving and we have no answers and we're complaining. The doctor only spent 10 minutes with me, 20 minutes with me. I cannot tell you this enough. Medicine, health, and medical now, the sectors, as far as patients are concerned,
Mhm.
are businesses. They're not a lot of times actually designed to really, really be able to help the patient. You do have those doctors and those nurses who will go out of their way to actually make sure you understand things, but they're not going to do it if you don't open up your mouth and say you don't know or say,
Right.
repeat that. I went to the doctor with my husband and the doctor's talking, and the words that he was saying, I knew what they were, but I'm not the patient. I had to stop him midstream and say, can you repeat that in terms that he understands?
Right.
I understand exactly what you just said. He's not going to understand it.
In
And
layman's
yeah, when he
terms.
comes home, he can ask me and say, well, what did he mean by that? But
Mhm.
you getting
Mhm.
paid a
Mhm.
job to
Right.
tell him what's
Right.
going on. You're the one that needs to break the health literacy down so they can understand. And he can understand what you're talking about. He
Mhm.
stopped and apologized. He said, I'm so sorry. And he explained it all over again and said, do you have any questions? Well, those are our active patients, and those are the type of patients that we want to see become more vocal in what they need and what they want. Make the
Yes.
doctors sit down and have those patient-centered conferences with you where you are talking and they are talking, and together you're coming up with a plan. You're just not
That's
walking out
right.
the door without having a plan.
That's right. That's right. Because it's your health. You have to be involved.
Yeah. So all of us are patients.
Mhm.
Every last one of us are patients. Which
That's right.
category do you fall into?
Mhm.
Right. So I thank you, Miss Tracy.
You're welcome, Sandra.
I look forward to seeing you again on one of our very many video sessions that we have in, and I actually look forward to bringing you on when you open up that assisted skilled living facility so you can tell people in Port Lucie, Florida, where they can find you at.
Yes. You want to know where they could find me?
Yeah, where can they find you at now? If they're looking for something online and like, I really like Tracy. I want to hear what she's talking about. Where can they find you?
You can go to tracythorntonwesley.com, and I do have a page. However, I do have another um, something that I do, and I do like group homes, but I don't have it. I do have it advertised on social media, Facebook. You can find me there. You can. I also have written 2 books. You can find me on Amazon. And to learn about diabetes and congestive heart failure, the assisted living facility page will be coming soon,
Thank you
very
for that.
soon.
And you know what? You actually brought something, another career path that you can actually take as a nurse, which is to
Uh-huh.
become an author.
That's
All
right.
the diseases that you talk about, there are patients out there that need that information, you nurses. They need that information that you have in reference to how to actually successfully treat a health condition, they need that information. And they'll pick up that book
In
because they
layman's
see
terms,
you.
because it'll be
Right.
easier, an easy read for them.
Right. They'll see the book and they'll be like, okay, a nurse wrote this. I know I could trust this. And
Mm-hmm.
they'll pick that book up, and that book will sometimes save their lives because there'll be information in there that you cannot find on Dr. Google or Mr. Firefox.
That's
So
right.
get to writing. That's another
Okay.
great career path
Yeah,
that a nurse can have, is to become a medical author.
that's true. Yeah.
I appreciate you, girl.
You're welcome, Sandra.
Thank you. Have
Thank
a good
you.
one.
You too. Bye-bye.
Bye.
It's a great experience for me. So
Good day, everyone, and thank you so much once again for joining in the